The most important study that I have chance to read was made in Russia, in Moscow. I understood very well what happened when we use the suture with barbs, because we can have a lifting of different area of the body, of a different area of the face, but we have another great things when we use the suture with barbs. So the revitalization. Because when I start to work with the suture with barbs, I don't believe that they can work very well, really. But I would like to make the follow-up. Before to say no good, I want to try. And I ask to my patients, what happened? And I ask to my patient, what do? You do peeling? My patients say not. Wow, I don't believe. Maybe you do some laser resurfacing? No, doctor. You make some mesotherapy? No, doctor. But all the patients reply me like this, and I don't believe. I believe that the patient go to another doctor to do something. I understood that are the cogs that give the revitalization to the tissue. The tissue start to produce new elastin, new collagen, new hyaluronic acid. The matrix totally change, and the skin become more younger of 10, 50 years. We can have not only the lifting, but in the same time the revitalization. Of course, we give immediately the mechanical lifting effect, but day by day improve the production of elastin, collagen, hyaluronic acid, and day by day until we have the total neutralization of the suture. And this take at least 1.5 years. But if the suture have no cogs, you don't have revitalization. And this is a law, histologic law. We have the proof about this. So it must be very important that the suture that you need to use must have the cogs, but not only the cogs, one more longer, one more shorter. The suture must be standard. You need to know the best angle, the best length of the cogs, the more higher density of the cogs for unit, for to have the best lifting, for to have long-lasting lifting, for to have revitalization. So much more important is the geometry, the parameter that you give to the suture with barbs.